Everything sounds really good today. I can see you and all is well.
Excellent. Well, I want to thank everyone that's joining us here today, either live or recorded for later viewing. Thank you very much for tuning in. It's our weekly Monday with the Mayor, where we have an opportunity to meet with the Honorable Will Haynie and also Lauren Sims. A couple of reminders, again, to continue to check the Coronavirus Resource Center page at the website, mountpleasantchamber.org. There is all kinds of information that is relevant to not only the virus itself, but also the business side and how the virus is affecting business. We have over 50 members that have put up offers and updates. So there are also links to all of our webinars, all of our Monday with the Mayors. So please feel free to visit mountpleasantchamber.org. You'll see the Coronavirus Resource Center page there at the top. You can click that and be directed to the page and see all of the resources there. So without further ado, I will bring in the Honorable Will Haynie, our Mayor, and Lauren Sims. Good afternoon.
Good afternoon. It's good to be back.
Good to see you too. Thank you very much for taking the time. We'll get right to it, Mr. Mayor. The numbers continue to increase. Cases are still on the rise, and I know you want to give us an update on how that looks. And Lauren, feel free to join in as well. But Greenville made a big call today, and wanted to get that information out to our members, please.
Sure. It's good to be with everybody. I hope you had a good Father's Day weekend. I know I sure did. And it was a good weekend just in general. Lots of people out and about in the low country, as you know. Suzette and I went out for the first time, I think since March.
Wow.
Yeah, we went somewhere, and it was a mixed bag of social distancing and disregard for social distancing where we were. Not going to pick on any one establishment. So, you know, there are some concerns. Let me set the stage with this, and then I'll throw it to Lauren for the updated figures. But locally or statewide, excuse me, the test to positive ratio, the number of people being tested the number of people positive compared to the number of people being tested is just below 13%. It was 12.6 in the latest numbers. And that is trending downward. Now, you know, I'm not an epidemiologist, and I don't play one on social media or on Zoom. You know, I don't know if that is because the prevalence of it is going down, which is what we would hope, but I don't know that. I think one reason could be that since there's more out there, there are more people with a potential exposure, so more people are getting tested who don't otherwise have any symptoms. I have some friends who fall in that category. They're very close to somebody who had it. They came up as a contact, you know, a traced contact, and they said, you've got good reason to get tested. And so the test to positive ratio is going down. But Lauren, I think you've got the overall numbers. And for those of you that are watching and listening, pay close attention. This is pretty serious.
Yes, sir. Good afternoon, everybody. So last Monday, I provided you with some numbers for South Carolina and for the county, as well as our local zip codes. Fortunately, DHEC has not released the updated zip code numbers, but I do have updated state and county numbers, which are quite startling. So for South Carolina, we are now at 24,661 confirmed cases. That's an increase of 5,866 cases in a 1 week period. We're up to 653 deaths for the state. That's an increase of 53. An increase in estimated cases of 310,400. So that brings our total estimated cases for the state to 176,150. For that same time period, a 1 week time frame for the county, we are at 1,836 confirmed cases. That's an increase of 744 cases. 19 deaths, which is an increase of 4. In estimated cases, we are up to 13,114, which is an which is an increase of 5,314 in just a 1 week period. Just kind of cursory glances though at our local zip code numbers. I think it's safe to say that from the end of May to now we're at the 22nd of June, our numbers have more than doubled, and in fact getting closer to tripled in terms of our local numbers.
Yep. So this is serious. One thing I got from our emergency coordinator, Amanda Knight, is that our regional acute hospital bed capacity, which is the real serious indicator in this, is now at 75%. So that was at 50% for a long time. Now it's at 75%. We all know people who have it, who have not shown many symptoms. I was talking to a friend of mine over this weekend. The husband, the wife, and the 7-year-old son all got it. The wife showed the worst symptoms. The 7-year-old son showed a few. He had a fever. They had to take him to the emergency room. The dad tested positive, and he, other than 1 day of fever, didn't have any symptoms. So, you know, I've been accused on Twitter of being a fearmonger on this, and I'm not trying to be. But let's be serious about what we've seen in the last week. Doesn't really matter the overall numbers. To every business is not concerned about all the overall numbers. What businesses are concerned about is what happens in their establishment, and we've all seen some well-known local restaurants, some in Mount Pleasant, some downtown, who had to close because a staff member in a food service organization tested positive, and they chose to close down. So what I'm telling everybody now is back in March and April, to flatten the curve based on our healthcare capacity, our capacity to treat it, we did the stay-at-home orders, and businesses, non-essential businesses, were shut down. Now, government is not shutting down the businesses. Now, business owners are shutting down their businesses, and it's because of the virus. So the opportunity we have here is to realize, and DHEC stressed this again this weekend, we know and we know and we know how we can stop this, and that is social distancing, and that is to wear masks. That's really all there is to it. So that leads us into, I watched a press conference earlier today. The city of Greenville, not the county, but the city, now has it'll go into effect at noon tomorrow, a mandatory mask regulation that everybody in grocery stores and pharmacies has to wear a mask. That's because that's where you're exposed to more vulnerable populations, especially the elderly and the health compromised. You don't have to be elderly to be in that category. And then all retail workers, and correct me if I'm wrong, Lauren, because I just saw this. I saw the press conference, and then I just saw the recapitulation of it. But everybody working in retail is going to have to wear a mask in the city of Greenville. And so I have been having this conversation since late last week. I've been talking to other mayors about it. I'm going to, just to see if there was any inkling of this in our region. We'll be talking to some of our council members today and tomorrow. But if you're watching here now, if you would use, what's the best thing to use here? The chat feature, Shane, that we talked about?
Yes, sir. Yeah, the chat feature. Mm-hmm.
I'm getting inundated with emails and social media messages asking us to do something in the town of Mount Pleasant. I would like to know what you, the listeners, think. If you would use the chat feature, would you favor some type of mask requirement? One thing about Greenville is you don't have to wear a mask outside. You don't have to wear it in a parking lot. You have to wear it when you're in a confined space, in a grocery store or in a pharmacy. If you're in Lowe's or Home Depot or somewhere like that, Walmart, you don't have to wear it. So would love to see what y'all think, because here's what I'm getting back from some business owners is they're very concerned that it's going to come back to them. They're very concerned that they're going to have to close. And I think businesses don't want to on their own say, hey, if you're not wearing a mask, we don't want your business. They might want some help from us in government. So I'm trying to tread lightly here, but get as much feedback as I can to find out what everybody would like to see.
So Mr. Mayor, would that be a situation where, let's say, for example, would each business make a mask available? Obviously, you can purchase masks. You can have, you know, a mask that you reuse. What would that even look like? Would it be on the onus be on the consumer or the business to make sure that that person has a mask? What if you can't get one? I don't know. I'm just talking out loud.
What we have at Town Hall is we require everybody that comes in, if you come to Mount Pleasant Town Hall, you have to wear a mask. You all know that last week we had to close down our municipal court because we had a positive case there. We've had a positive case in somebody that's not a police officer but works with the police. And we had a positive case of a public services worker. But when you have to shut down municipal court, then the wheels of justice, you know, are slowed even further, and that's not great. So you either wear your own mask, or if you don't have one, we have the disposable mask there. for you to take one and put it on. So I guess if we were to have something even close to what Greenville has, you know, you would want to have them. You would want to have them there. I understand that can be a burden. You got to supply them. You would need some lead time, but also having to close down because of a positive with your staff or something is probably going to be a bigger hit to your business than just making sure everybody has a mask if they come in. So I see we're getting some responses. I'm going to take a look at those. Lauren, if you'll take a look at some of those as well. So
Yeah, we've got a couple of, we've got a few folks that say yes, everyone should wear a mask. We have one for no. But yeah, feel free to comment. If you want to put that in the Q&A or the chat box there, let us know what your thoughts are on a mandatory mask policy in pharmacies, grocery stores, and then obviously too for retail and hospitality, requiring those employees to wear masks. It's good feedback to get.
Things I want to say. I guess it was a week ago Thursday, I had my teleconference with the school district. They're still not sure what the school year is going to look like. They'll be announcing it in July as soon as possible. I think Accelerate, the Accelerate SC, the education part of that, Accelerate Ed, is either coming out today or has already come out with what they're recommending. So the prevalence of the virus and the number of shutdowns in businesses and things like that will probably also affect what the school year looks like, which will also affect your business and your staffing. And also, we're all in this together. Nobody wants to have to do another state of emergency. Nobody wants to have to do any shutdowns. I don't see that coming at all. And let me just say this. I read something on social media. I know something good on social media this weekend that said about wearing masks. If the experts are right, I could stop the spread of this that will possibly keep someone from, you know, getting sick, being in the hospital or dying, or keep a business from being shut down. And if the experts are wrong, all I'm out is for a temporary period, I wore a piece of cloth over my face. So I know my wife and I do it when we go in and out. If you see me in a restaurant when I'm at my table, my mask is off. But if you see me in the grocery store or Lowe's or somewhere like that, I have my mask on. And it's really not that big of a deal. My dad's a retired physician. He wore a mask all of his career. And he assures me that anything you're reading about getting poisoned by it or it causing seizures or whatever during his 35, 40-year medical career, he never saw that happen. And he stood with doctors when they were doing surgery for, 8-10 hours at a spell. So I don't think that going into Lowe's or I know I've mentioned that too many times, the grocery store, Whole Foods, or somewhere with your mask on is gonna bother you. So we'll take a look at sort of our unofficial poll here and see what the pulse of those attending this chamber Zoom session, see what their preferences are.
And it's safe to say that if you have not purchased masks, or if you don't have any masks, you might want to go ahead and do that. I know of a couple of locations in Mount Pleasant that sell them. So if you'd like more information on where you could purchase those, please reach out to us. You can reach out to me directly, Shane at mountpleasantchamber.org. Reach out to Rebecca, Tamara, send us an email at the website, info@mountpleasantchamber.org. We'd be happy to point you in the right direction to make sure that that you have a mask. And Mayor, if I may ask, this is kind of off the path here, but given your father's background in medical, I've heard varying answers on this regarding the masks and how many times you wear them. Do you know the answer to that? I know that the temporary masks that my wife and I wear, we just toss it after the first only one use. I don't reuse those because I've read that you should only use them just once and then just toss them out. Am I wrong in that, or?
I don't claim to know. We've got 3 different types in my house, and we treat them different ways. I know that at Mount Pleasant Waterworks, where I sit on the Waterworks Commission, they use an autoclave like we all used to have in our science lab in high school or college, and they're able to disinfect and reuse those. But I don't want to go out on a limb and tell you what the safe practices. I do know that there are some of in the risk management side of municipal work that will tell you that the best way to manage the mask when you're wearing it is to carry a small, like a sandwich size paper bag. So when you take it off, slide it in that paper bag. That way you're not putting it on your desk or a restaurant table, you're not touching it. You just slide it into that bag. So that makes a lot of sense. I've tried to do that myself. Lauren, did you have any input about masks and where they're available or that type thing? I couldn't remember if you had any info on that.
I don't off the top of my head. I know we've had some vendors who have reached out and they have branded masks available. Certainly happy to point folks in those directions if you're looking for something that's a little snazzier for your employees. But in terms of easy disposable ones, I'm not sure of those. But we can certainly find that information for folks if they're interested.
Okay.
Well, excellent. We thank you both for the input on that. Thank you for the update on the numbers and helping us with that information regarding the city of Greenville. It's definitely interesting. Probably the first domino to fall. I would suspect that if things continue to move in the course that they are, that we may start to see, Columbia and then moving on down possibly. Who knows? It's all out there. So we'll obviously keep our eyes on that. And we thank you, Mr. Mayor and Lauren, for communicating that with us. Mr. Mayor, let's talk about Safe Harbor. I know you have an update from the South Carolina legislature that you want to get across.
I was talking to somebody that works with legislators. I was with him on Friday, and the bill to give businesses a safe harbor, a liability protection if a case of COVID is tracked back to your place of business. The Senate will be taking that up, and I can't remember. I need to look back through my other notes if they're taking it up this week or if it's after the 4th of July. But in July, we will have a statewide, unless something goes way off the rails, we are expecting to have statewide legislation that gives businesses a safe harbor act to limit your liability on things like that. What I was told was there would have to be gross negligence. But the other thing I heard is that the version in the Senate, in the South Carolina Senate, does not contain a loser pays provision, which the reason you want that is so somebody doesn't just go throw in lawsuits at every large corporation that they shopped in. And so we'll see, or even your local business. So we'll see how it comes out of the Senate, but that is in the works. And I know that's very important to a lot of business owners.
Let's stay with that topic regarding businesses and finances, and that the PPPFA of 2020, the PPP Flexibility Act of 2020. I know you have some information on that as well, and Lauren can feel free to jump in on that too.
Sure. I thought this was apropos for today's conversation, that the applications must receive an SBA, a Small Business Administration loan number, by the 30th of June, and that's coming up quickly. There were some new applications that were issued on the 16th very recently. These are revised forms of the loan forgiveness application, and that form is 3508 in case you're interested. If you got one or you want to get one, 3508 is the form. There's a 3508 EZ. The government always does that. There's the form and then there's the easy form. There are lots of regulations as to who can use the form EZ and who can't. And I believe to use the short form, the EZ, you have to have not had any staff. But it can help you as a small business owner. Again, I'm just giving an overview. I don't pretend to be able to give all the details. The EZ version is only 3 pages long, and there are 3 or 4 different requirements for that. And then if you are using either of the applications, the regular form or the EZ, you'll be required to disclose the number of employees you had at the time of the forgiveness of the application. Remember, it was originally that you had them, and then you had a period to get back staffed up. And then now, and I think Lauren has even mentioned this before, that they have extended the maturity date if you have to pay it back from 2 years to 5 years. Is that correct, Lauren? You have 5 years to pay it back. And so all the loans made on or after June 5th of this year will have the 5 year, but the maturity date for all the loans made before June the 5th remains at 2 years. So if you didn't get a Paycheck Protection Plan loan, now's the time to do it, and you have 5 years. And you can also apply to have that forgiven. So that's something to think about. I think I reported last week that the South Carolina survey, taking the temperature of small business owners, 500 employees or less, everybody, the majority, 60% of those folks said that they think their business will be back to normal in 4 to 6 months, and that was from May. So that's sort of the business outlook. I have to tell you, there are a lot of us who thought when this first started it would be a lot longer than 6 months. So on the one hand, that's only 60% of respondents feel that way, but on the other hand, 60% of people feel like by the end of the year, things are going to be back to normal. I was in a meeting Friday with one of our large local restaurant owners who owns restaurants here and all over the state, and he said that his restaurant sales overall are back to 80% of what they were, even with the limited seating, they're back to 80%. And I was joking with him, halfway joking, and I said, but doesn't liquor sales account for a lot of that? Because we all know liquor sales have spiked during all this. And he said, interesting that you should say that. Beer sales are down 33%, but hard liquor sales are up. I don't know why, maybe somebody here knows, but it was good to hear that a large restaurant group like that is at 80%, pre-COVID numbers. If you're on today and you're in the hospitality business, if you want to give us a little idea of how things are going for you, put it in the chat right there so we'll know. I've heard that hotel occupancies had rebounded pretty well, probably not to where they were, in a normal summer for this time of year, but they had rebounded, how do you say satisfactorily? You know what I mean, to where people are operating and they're paying the bills and the staff's getting paid. And the figure I heard from one group was like 80% occupancy. So that's a relief. We'd rather it be way back up where it's supposed to be. But there was more gloom and doom 4 weeks ago, 6 weeks ago than what I'm hearing talking to businesses now.
And I would agree with that too. From my perspective, being in advertising sales, I actually had a lunch with an automotive client of mine, and they're coming off 2 of their most profitable months in history. The problem they're running into now is that they don't have any inventory. So
Right.
Cars aren't being built. It's slow to get them in. Right now, used cars are being bought at auction for sometimes more than they were purchased for when they were sold new. So it's that scarcity, that supply and demand, at least in the automotive industry, coming off great months, but now it's getting into an inventory issue. And really, it depends on each business category. Some folks are really thriving in this environment, and unfortunately, many of us are not. So, as we've said before, just gotta keep pushing forward and keep your chin up and do the best you can, take it a day at a time. And I can tell you that Trident Tech is doing everything they can, Mr. Mayor, to help folks move forward. Free tuition. Am I wrong about that? Is that crazy or what?
They tried it last year. They announced they're doing it again this year for the fall semester. And it will be, you can get free tuition by enrolling in one of 70 programs in the study fields of manufacturing, information technology, culinary and hospitality, emergency medical technology, and technical trades. And I spent part of my career 20 years ago in workforce development in the state of North Carolina, and in an area where there weren't many alternatives, and saw firsthand what a great education you can get at a technical college. And our workforce here is, everybody knows, is a not a huge concern, but a huge focus, because we've supplied 50,000 jobs in the last decade in this area. And so we've got to keep this educated, trained workforce coming, and Trident Tech is doing that with free tuition. And I think if whatever business you're in, everything from medical to hospitality to IT, and maybe we've got the gamut watching today. If you've got some folks that need some training and are potential employees, that's a good deal right there. The best tuition is free tuition. Hard to beat.
Absolutely. And also to dovetail with that, be sure to visit our website, mountpleasantchamber.org. We do have a job postings page. So if you are looking to hire more folks, or if you have an opening that you want to make our members aware of, just visit the website, mountpleasantchamber.org, and you can post the job there. That's all I have for today, Mr. Mayor. Lauren, anything else you want to communicate before we let everybody go?
Two things. I'll remind everybody one more time about the One Region Ready. You go to the website, go to either CRDA, Charleston Regional Development Alliance, or go to oneregionstrategy.com. And it doesn't cost you anything. And all you do is you do that pledge, and then you get that seal of approval. And the town is in the process of filling out everything we have to do. We're trying to get government agencies, and all it says is, I looked at the guidelines for my specific industry, and we are following those. And you are on a searchable database, and people will see that you are doing that. And I think now that as numbers go up, as COVID numbers go up, a lot of people are going to be more careful, and they might look to see who you are and where you are. And Lauren, I'll throw it to you because we have our town map as well, right?
Yes, sir, we do. It's available on our website, and it's very easy to modify your information if your services change. But it is a GIS-based map, so we'll put an icon exactly where your business is located. We can upload photos or diagrams if you submit them to us for something like expanded outdoor operations. But you just let us know how you are operating, what services you're providing, and we'll be happy to put that on our map for you. Very simple.
Sounds good. That's it.
Is that it, Mr. Mayor? Anything else you wanted to communicate?
That's it. I want to look at the, see what kind of chat responses we got about face masks before the screen disappears.
Absolutely. It looks like we have, by my quick math, what do you think, Lauren? We have 4.
There's 4 yeses and 1 no.
Four yeses and 1 no to the masks, mandatory mask policy.
I don't know how to count the Philadelphia Eagles one though. That means
Yeah, there's one in every crowd, and today it's Brian Sherman. So, yeah, Brian Sherman, one of our longest running members, of course, and a big Philadelphia Eagles and Phillies fan. I've been trying to convert him to a Redskins fan for ages, but he'll have nothing to do with it. But yeah, evidently, according to Brian, the most efficient masks are those that are adorned with the Philadelphia Eagles logo.
Is that because nobody will get closer than 6 feet to you, Brian?
oh.
I call them the Philadelphia Eagles. It's the Eagles. They stink. Anyway, so yeah, but it looks like 5 votes in, 4 said they would support a mask policy, and 1 said they would not. But again, the city of Greenville has put in a requirement for masks inside pharmacies and grocery stores, and then employees at hospitality and retail required to wear those masks as well. So we'll keep an eye on that as we move forward. A reminder to visit our website, mountpleasantchamber.org. If you need to reach out to me directly, please do that. If you need a resource, a person, have a question, we're always available to you. Shane at mountpleasantchamber.org, Shane at mountpleasantchamber.org. You can also reach out to Rebecca and or Tamara. Just send us an email to the website, info@mountpleasantchamber.org. Mr. Mayor, Lauren, great to see you both. We look forward to seeing you back here next Monday for Monday with the Mayor. Thanks again.
Thanks, Shane.
Thank you.
Everybody, and thanks for your response on the question.
Everybody have a great day. Remember to be safe, stay healthy, keep moving forward. See you.
Bye-bye.